Thank you, Acting President. I rise to speak on the Mental Health and Wellbeing Amendment Bill 2023. As with the Mental Health and Wellbeing Bill 2022, I will not be opposing the legislation before us today. But before I address some of the specifics of this legislation, I think it's worth reflecting a little bit on the past 3 years and the impact that government decisions are continuing to have on the mental wellbeing of Victorians. Many of my colleagues who are here in the chamber today weren't present for the dark days of the pandemic, but for those who were, you'll no doubt remember me frequently raising the issue of mental health harms when considering how the government responded to the COVID-19 pandemic. One of the first issues related to mental health harm of the government response that was brought to my attention were the mask mandates, and in particular, the effect that this had on victims of family violence and sexual assault. But I couldn't even get the Health Minister, Premier or the Chief Health Officer to adjust their language to try and prevent people who couldn't wear a mask getting bullied or even worse, verbally attacked on the street. While I could recount many specific stories from the tidal wave of misery that was produced, I want to highlight one of the key harms that I maintain was a reckless and irresponsible trade-off. I'm referring here to the closing of schools. During the Pay at COVID inquiry, the government confirmed that they hadn't done any modelling to better understand the harms caused by the government response to the pandemic. We heard from experts in the health, mental health and social services sectors. Professor Patrick McGorry stated, and I quote, "We already know that there's a 33% rise in deliberate self-harm presenting to emergency departments, and it's actually really even more dramatic than that, the Royal Children's and some suicide clusters, but probably there's been no significant rise yet in completed suicide," end quote. The Commission for Children and Young People also did some great work over that period, producing regular snapshots, surveying young people on how they were coping during the pandemic, and particularly with school closures. While not all young people struggled, the stories from the ones who did are quite harrowing. I won't read out quotes from the various reports, but suffice to say they are heartbreaking expressions of loneliness, sadness and despair. It was with this suffering in mind that I introduced a motion into this chamber in 2020 calling on the government to reopen the schools. Whilst this motion wasn't successful, everything that occurred after this has only convinced me that it was the right thing to do and would likely have prevented some measure of harm to young people in this state. It was common to hear people state, even in this place, that, quote, "the economy doesn't matter," end quote, when you're trying to save lives. This was always a naive claim. Indeed, Professor McGorry, in his testimony just prior to the previous quote I read out, stated this, and I'll quote, "As I said earlier, we could predict a rise in suicide, particularly because of the economic impacts. That is really one of the most potent drivers of suicide in these conditions," end quote. Of course the economy matters. When people are struggling to pay their bills and feed their kids, this has an impact on mental health. We are only seeing the beginning of this now. We can't spend our way into prosperity, and the ever-increasing taxes, fines and fees imposed on Victorians will continue to create harm. In these circumstances, people may more frequently have to deal with the frustration of government services and heartless bureaucracies. And I don't mean to imply that people working in the public service are heartless. I'm sure that many of them are well-meaning and some of them even likely very hard-working, but the system itself is heartless. The Victorian Ombudsman, Deborah Glass, did some excellent work during the pandemic, and while the inquiry into the public housing towers lockdown has received more media attention, the inquiry into the border closures provides a very clear demonstration of how heartless the bureaucracy can manifest itself. Let's reflect on what this inquiry was all about. The government announced with almost no notice that they would be instigating a hard border closure with New South Wales. We essentially created a situation where many Victorians may have met the international definition of internally displaced people. That is, they're internal refugees of our own citizens. To better understand the full impact that a heartless bureaucracy can have on mental health, I want to read a couple of brief quotes from people that provided comment for the Ombudsman's report. And from page 7 of the Ombudsman's report, I quote, this is from a contributor, "I had to constantly book online appointments with our doctors to get more and more paperwork vouching for the severity of our mental health. It was so dehumanising and humiliating. I had to call and threaten self-harm to feel like I was being taken seriously," end quote. And from page 8 of the Ombudsman's report, I quote, "We just want an exemption to be with our dying daughter. She is terminal, palliative and end of life. We are being treated inhumanly by a person making a decision taking wheats that we don't have." End quote. As I stated at the beginning of my comments, I won't oppose this legislation as I didn't oppose the reforms in 2022. A large component of what the reforms seek to accomplish is more patient autonomy, improved consent processes, and a framework for mental health that better meets the needs of consumers. And these are good things. But I simply can't comment on legislation related to mental health without reflecting on the harm done by the government itself during the pandemic period. While improving the functioning of the mental health sector is certainly not the worst goal of a government, they could achieve some initial improvements by cancelling COVID fines immediately. I'll close by quoting the Victorian Ombudsman from the close of the foreword into the inquiry into border closures, and she said, "I also encourage the government to publicly acknowledge the distress caused to so many people when discretion was exercised narrowly or not at all. If there is a next time, we cannot let this happen again." End quote. And I agree. If we are to prevent these things from happening again, we need a royal commission into the COVID response in Victoria. Being a Libertarian is sometimes described as like being the only sober person in the car and no one will let you drive. The government is driving us into the dark.